Namaste everyone. My name is Dr. Viny Kantroo and I am a pulmonologist and a critical care physician in Indraprastha Apollo Hospitals, New Delhi. Today we are going to talk about how many types of inhalers are there in the use of asthma and COPD. The inhalers can be divided on various modalities depending upon the content of the medication, the amount of medication or the composition of the drug which they contain, which means they can be in the form of dry powder inhalation or in the form of a mist. And the third way to divide them is whether they are longer acting, which are known as controllers, or the shorter acting ones, which are also known as the rescue inhalers. Now these have a color coding also. Your blue inhaler, which is light blue in color, it means that this is the rescue inhaler and needs to be taken when you have an asthma attack. This inhaler should always be kept handy in your purse or in your near environment if you're working in an office area. Once you have an attack, you can very well take it out and take a puff. The controller inhaler, which is brown in color, is absolutely essential in cases of asthma which are persisters. They need some form of medication which can control their inflammation inside the airway. These are various types of inhalers. The inhalation can also be given in the form of medication being converted into a mist, which means the suspension of gas particles which can be taken through the nebulizers. Nebulizers are given for people who do not have enough power to inhale the dry powder inhalers or the mist inhalers. Also, the multi-dose inhalers, which are actually the mist inhalers, are very difficult to coordinate between your hand coordination for pressing the inhalation and at the same time taking a deep breath to get your medication inside your airway. Therefore, in elderly and in children, the nebulizer is always preferred over these forms of inhalations. If somebody has a good power to inhale, but they cannot actually create some kind of coordination between their hand and the inhalation process, they can very well be prescribed the dry powder inhalers, which is very easy and to be decided by your doctor. So, happy asthma days!